Hi, I'm Dr. Nancy Blatt, and today we're going to talk a little bit about Lyme disease. I think most people are aware that Lyme disease is caused by a bacteria that's transmitted by the black-legged tick. It's very common out here in New England. In fact, if we look at data over the last 20 years, the incidence of Lyme disease has actually tripled. They say that 95% of the cases of Lyme disease actually come from only 14 states, and all of New England is included in that. So I wanted to talk a little bit about the signs and symptoms. I think some people are aware of them. In the medical community, we tend to differentiate into early Lyme and then late Lyme. Basically, if the disease goes undiagnosed, it can actually start to affect your brain, your heart, there can be potential serious consequences if it goes undetected. So it's really important. Lyme is somewhat of a great masquerader, so unfortunately you have to be really aware. Usually the first stages of Lyme will start out almost like a flu-like illness. Patients will have fevers, chills, they'll have body aches, specifically in the joints. Many times they will have a skin rash. The classic skin rash people are aware of is the classic bullseye lesion. We call it erythema migrans, or EM. That's usually in the early stages of Lyme. The shame is that if you actually go and get a blood test in the early stages of Lyme, there's a really good chance that the test is going to be negative. And that's because the test that we currently use is checking for an antibody, and those antibodies take time to develop. Usually in the early stages of Lyme, the symptoms are less than 30 days. Usually when you have the EM, it's probably about 3 to 14 days after you've been infected. If Lyme does go undetected, it can progress. We do know that you can see disseminated Lyme where you have multiple EMs on the body. Sometimes they aren't classic bullseye lesions. They'll be completely filled in, look just like a large red splotch in different areas. That's a sign of disseminated Lyme. Other things patients need to be aware of is that it can manifest with a facial nerve palsy, otherwise known as Bell's palsy. And if left untreated, it can potentially be very serious. It can lead to headaches, inflammation of the meninges, which is basically layers that surround your brain. It can lead to some permanent cognitive defects as well. It can also affect the heart, which a lot of people are not aware of. It can not only cause inflammation around the heart, but inflammation of the heart muscle itself. It can actually lead to heart blocks and different arrhythmias. The diagnosis of Lyme is based on several different things. A big part of it is clinical history. Obviously, it's more prevalent in areas that are endemic to having the black-legged ticks that carry the Borrelia, which is the bacteria that causes Lyme disease. Oftentimes, we'll use not only the clinical history and exposure to ticks, we'll use the signs and symptoms as discussed above. There is blood work. I'll just start by saying that the blood tests we currently have available are somewhat controversial, and as clinicians, we usually do follow the CDC guidelines, which recommends a 2-stage testing. Basically, we start out with a test such as EIA or an IFA, which are basically screening tests. The trouble with this first step is that it has a high risk of false positives, and that's why you want to use it in combination with a second test. For example, with the first screening test that we do to detect Lyme, it can actually also cross-react with other common pathogens, the chickenpox virus, Epstein-Barr virus, as well as even the lupus antibody. So what happens is we usually do recommend doing the initial testing, and then if it is positive or what we call equivocal, meaning it is not completely negative, we go on to a second test, which is usually a Western blot. Once we do the Western blot, there's 2 different types of antibodies that we're measuring. Something we call IgM, which is kind of the first antibodies that your body first produces after you become infected with the disease. And then the IgG, which is the antibody that tends to stay around longer and that can be detected usually at least a month after being infected. So a little bit more on the testing. Like I said, if you go in to see your doctor early on in treatment, when you have like an EM rash, there's a good chance the testing is going to be negative. In that particular case, many times we do recommend retesting in 4 to 6 weeks. So the accuracy of the test definitely depends on where you are in your clinical symptoms, and it is imperative that you do the first stage in testing as well as the secondary testing if the first step is positive. The current guidelines state that if the first test is negative and we're within the right time frame, that you do not need to go on to do further testing. But the CDC as well as the scientific community does acknowledge that this is controversial. There is other testing available. It has not become recommended as it is not necessarily FDA approved or covered by insurance companies. There are labs in different parts of the countries that will do some definitive testing, but it's usually an out-of-pocket expense. So next I'd like to talk a little bit about prevention of Lyme disease. We've talked about how prevalent it is, how serious it can get if it's left undetected. So let's talk a little bit about prevention. So many people are aware we start prevention with basically personal protection, which basically means use common sense, like try to avoid wooded areas or areas that have high grass where there's going to be a lot of ticks present. After you've been outdoors, make sure you do tick checks at least once a day. Additionally, if you've been outside, we do recommend showering within about 2 hours after being outside. There is some research to support taking off your clothes, throwing them in the dryer for at least 10 minutes on high. That has been shown to actually kill ticks in different stages. Other things that we talk about for prevention include like environmental controls. So people have done studies looking at trying to not only spray for ticks or use pesticides or use landscaping that keeps the ticks where they're at. So we target it basically with decreasing the number of ticks and decreasing the tick habitat. They have used different models looking at the whole life cycle of the tick and the animal reservoirs, if you will, including mice and deer, that allow the ticks to become more prevalent. In New Jersey, they actually did do a study using a combination of bait traps for mice, basically giving them a pesticide that will kill ticks, as well as targeting the deer population using topical pesticides. And some of that data showed that it was up to 95% effective in decreasing the number of ticks. The other important thing that we have besides environmental controls or personal protection has to do with prophylaxis. So what that means is, in endemic populations such as in New England, if someone has a documented tick bite from the ixodes tick, which is the black-legged tick, and it is within 36 hours of the tick bite, based on exposure. Some people actually base it on the engorgement of the tick, and it's been within 72 hours of removing the tick, and medications are not contraindicated to that patient, we can actually prophylax. So some people may be aware. We usually use a antibiotic called doxycycline. In adults, we usually give a one-time dose, again, if all those criteria are met, and it has been shown to decrease the transmission of the Bordetella into the body, thus preventing Lyme disease. We do use this in children ages 8 and up, and it's based on their weight. The final thing I wanted to talk a little bit about was Lyme vaccine. This is a very hot and very controversial topic. I don't know if many people are aware, but we actually did have a vaccine for Lyme years ago. It was actually originally manufactured in 1998, and it was on the market until 2002. It was indicated basically for patients ages 15 to 70. They did have data in the pediatric population, but it did not get a chance to be used. It was actually shown to be over 80% effective. That vaccine was called Lymerix. It was actually removed by the FDA because of poor sales, as well as there was a class action lawsuit. Basically, there was some thought at that time that the vaccine might be causing an autoimmune Lyme arthritis. Patients were complaining of getting the vaccine and feeling like they were getting joint pain. What happened was, after the vaccine was pulled from the market, the scientific community as well as the FDA went back and looked at all the research, and the vaccine was not thought to be causing any harm. But we have not had a new vaccine for Lyme on the market in the last 15 years. But the research is there. In fact, how that vaccine works is what most scientists are building on now. So when you're developing a vaccine, you want to use the body's own immune system in order to battle off the vaccine. So that particular vaccine, the Lymerix, targeted what we call an outer surface protein, and this was outer surface protein A, so we call it OPS-A. What happened was we would inject patients, that was a vaccine, with a small amount of the OPS-A. Your body would develop antibodies, and it would actually block transmission. So if a tick were to go and try and bite you, and you had already been vaccinated, you would have antibodies that would actually stop the transmission of that particular bacteria. So again, 80% effective. Some of the data in pediatrics was thought to be even more effective. And with the new vaccines that are built on the technology of the OPS-A, the other important thing that they have done is they have taken out that segment of the protein that was thought to be potentially causing harm with the first vaccine, the Lyme-Rix. Newer technologies are focusing in on different proteins within the bacteria, not only to block transmission, like the OPS-A, but also to potentially clear infection. And so they're looking at a protein called OPS-C, again, outer surface protein C, in order to develop a vaccine for that might actually be able to clear infection in patients who have been infected. There has actually been some successful animal studies done with this. So the technology is there. Hopefully in the upcoming years we will have a vaccine that is FDA approved that we can use to help protect our families.